Unless you've been living under a rock in a distant galaxy far, far away, you've heard of it. Coronavirus. To date, more than 168 million cases, at least 3.5 million people dead, and the search for patient zero continues. At the heart of that search is the question, where did it come from? From the beginning, the prevailing theory has been this virus passed from animals to humans. It still is. The wet market in Wuhan, China was linked to early COVID cases. But more than 18 months after the first case was reported, no one knows what animal might have been the source. It was initially thought it was a bat, the same as the SARS epidemic almost 20 years ago.
Most coronaviruses that we know of are of origin from that have infected the population. SARS-CoV-1, MERS generally come from an animal origin.
The US Centers for Disease Control website still says, we know that it originally came from an animal, likely a bat. But now, what was considered a conspiracy theory, that the virus came from a lab in Wuhan, is now being seriously considered.
President Biden now calling on the US intelligence community to intensify its investigation into the origin of COVID-19.
And US President Joe Biden has conceded the American intelligence community is split between the two theories, albeit with low to moderate confidence in either. Wuhan, China is home to the Wuhan Institute for Virology, which studies coronaviruses. And the Wall Street Journal, citing a previously undisclosed US intelligence report, recently revealed 3 researchers from that institute became sick enough that they sought hospital care in November 2019, a month before China reported its first case. In fairness, though, in China, even for a moderate cold, people usually go to the hospital to see a doctor.
It comes from China.
The Trump administration's dogged pursuit of China as the culprit for the pandemic cast its lab leak theory in a dubious light. Beijing all along has characterised it as nothing more than a smear campaign and has actually turned the accusation back on the US, alleging without any evidence that the virus came from a US Army laboratory. Most scientists still say an animal source is the most likely, including the team of international researchers who went to Wuhan and issued their report in March this year. But their access was limited by the Chinese authorities. Now, the Biden administration is asking the US intelligence community and other agencies for a 90-day review on the origins of this international catastrophe. But experts point out the passage of time makes it more challenging to reach any conclusions. And as for the lab leak theory, like all theories, it's difficult to prove a negative, that the virus did not come from the Wuhan lab. But finding the source could be the key to preparing for future virus outbreaks and even preventing them. And so the search goes on.
Well, let's turn now to Professor Dominic Dwyer. He was the Australian representative on the International World Health Organisation's investigations into the origins of the novel coronavirus. Professor Dwyer, thanks for joining us. You've been to the Wuhan Institute of Virology. Do you still think it's extremely unlikely the virus escaped from there?
Look, I do think it's unlikely. I mean, we have many other viruses that clearly have gone from bats into animals into humans. The laboratory was certainly involved in bat research, but you've got to understand how laboratory leaks occur to try and put the evidence together. So yes, you can run into troubles by collecting a sample or handling a sample in the laboratory, but most laboratory leaks of an accidental nature occur when people are growing up large amounts of the virus for research purposes or vaccine studies and so on. And at least the virus most closely related to SARS-CoV-2 actually has never been cultured. It's one of those viruses that's hard to grow. So I think that the WHO team always left the lab leak on the table. It's just that you need evidence of some type to take it further. You've got to be driven by the evidence.
You know, has anything actually changed this week? Do we have any more evidence at the moment that there potentially was a leak?
No, look, I don't think we do have any evidence. The US intelligence forces were asked to show if they had any information that might be helpful. They haven't done that as yet. The fact that President Biden said that he's getting conflicting reports from his intelligence agencies, to me suggests that there is no clear evidence, because otherwise it would be obvious what was going on. I think also the difficulty of getting this evidence, can't be underestimated. It's not easy to get. And so I think we just need to see the evidence. If we've got it, let's act on it, but show us the money.
Do you fear that there's any, chance that evidence is being concealed here? Did you get the access that you needed to investigate all possible theories when you were on the ground in China, like a lab escape?
Well, look, I think the evidence we got and the questions we asked and the answers we got are really what I would expect if I was doing the same sort of investigation in Australia or New Zealand or somewhere similar. So I think that they were pretty open with what they gave. Now, of course, whether they hid things, well, by definition, we wouldn't know. But the responses they gave and the data they did give was pretty consistent with a normal outbreak investigation. I think one of the difficulties is that nobody knew what was going on at the time, and the sorts of work you would do to try and figure things out right at the beginning is actually very difficult when you're in the midst of thousands of cases presenting to hospital.
So the US President Joe Biden said his intelligence agencies, as you've mentioned, have put forward conflicting ideas. No one has any particular confidence in any theory, it sounds like. Do you think we're ever likely to get any more clarity, or is this whole investigation process in the United States likely to end up turning up what we know at the moment, which is very little?
Well, look, you've got to remember that origins of diseases, those sorts of studies can take many, many years. I mean, we've had Ebola virus outbreaks in Africa for 40-odd years, but it's only in the last few years that the origin of that virus became apparent. Same with SARS back in 2003. It took 10 or 15 years before the causative sort of virus in animals was found. So it can take time. Then the key thing is the only way you're going to act on evidence and investigate things if people are cooperative. And so you have to develop cooperation, you have to work with people in an open and transparent manner to get things done. So the more people fight about it, or the more people use politics to score points or whatever it might be, the less likely you are to get the cooperation to work together to sort it out. So I would plead that the diplomacy improve so that we can get on and do the science.
Professor Dominic Dwyer, appreciate your time and your insights so much. Thank you for joining us.
Thank you, Casey.